Today, we're very excited to share some information with you on the newest product that's been added to our product shelf, and that's Maple Virtual Care. I am joined here today with Allison Rue, manager of the Health Solutions team at People Corporation. And we've been working closely with Allison over the past year, transitioning our medical second opinion, business assistance program, and EAP from Humanicare over to People Corporation. The Health Solutions team believes that wellness is a holistic approach to a person's state of being. The team leverages People Corporation's size and scope to help bring preferred pricing and products. They use their subject matter expertise for growth and supportive distribution, and they partner with us to help create unique product solutions to help you differentiate your offering. Before we begin, we have a couple of housekeeping items. First off, all attendees are muted during this presentation. If you have questions, we encourage you to please use the Q&A button at the bottom of your screen during the presentation, and we will address them at the end of our session. This session is being recorded, and a copy of the recording and presentation, as well as marketing resources, will be shared with you by the end of this week. So before further ado, let's move over to the next screen, please. All right, so today we're going to provide a bit of a business case for the need for virtual care. Allison's going to walk through and provide an overview of Maple, and then I'm going to highlight BBD's offering. And then this stage will be passed back to Allison, who will finish off with sort of next steps in getting started and helping your clients navigate adding Maple and what that looks like. And then we'll answer any questions at the end of the day. So over to you, Allison.
Great, thank you. Happy to be here today. Before we dive into the specific details of our Maple offering, we first just wanted to set the stage for why virtual care and an offering like this is important to many individuals and our clients today. So as we know, in 2024, our healthcare system is strained. There's a lot of people who are experiencing delays with accessing care. A lot of people don't have a family doctor. As we can see on this slide, 22% of Canadian adults do not have a family doctor. And even if someone does have a family doctor, I'm sure you maybe have experienced this yourself or have a family member or a friend who has said, you know, I have a family doctor, but getting into them is often a struggle. It can take, weeks, and by then it's too late, or, they've already gone to a walk-in clinic to get support for their concern already. So virtual care is really a nice avenue for many people to have as an added benefit to accessing mental health and physical health support in a quicker format. So virtual care is really interesting and attractive to many individuals. Organizations have seen and experienced increased pressure to take care of employee well-being, especially since the COVID-19 pandemic. And many employees are seeking organizations who have virtual care as an added benefit because they experienced the benefit of this service during the pandemic, when most of physician appointments were done virtually. So there's a lot of benefit to virtual care. Virtual care empowers employees to get access to support quicker. It's beneficial to the organization as well because there's less time taken off work. Employees are more productive when they're feeling well, and you can see the benefit from there. With regards to continuity of care, virtual care in a format like what Maple provides is really beneficial to those who especially don't have a family doctor, but to anyone who typically bounces from walk-in clinic to walk-in clinic. Because when you're going to walk-in clinic in your community, there's no sharing of information between those doctors or those clinics, whereas a virtual care setting like Maple holds all of the information in one place. You may not see the same virtual care doctor each time you call in, but the records are stored in one central place where there's that continuity of care each time you call in. And like I said previously, improving organizational health is the key foundation of virtual care as well. A healthier workplace is a more productive and more resilient workforce. So having early intervention to accessing support is really beneficial for all parties involved. So that sets the stage for why virtual care is important. And now we'll proceed into the more specific details of what Maple provides. There's a variety of different virtual care providers out in the market today. Maple is a really unique offering because it's a physician-specific network. There's some providers that provide a combination of nurse practitioner and family physician doctors in a virtual care format. Some are just nurse practitioner, but Maple is solely driven by family physicians or ER doctors. So it's a doctor-driven network, which many users calling in really, really like because they know they're speaking to top quality doctors. There's over 700 physicians within the network all across Canada. Really accessing support is done within 5 minutes or less, and it's available 24/7. So you can see how beneficial this is rather than driving to and sitting in a waiting room or going to the emergency room and waiting for hours upon hours. Maple also offers a bilingual service, so it's available in French and English. There's a mobile application and a web application, so it's truly available at your fingertips. When you experience calling in to Maple, it's like just being in front of a doctor in a doctor's office. They can do all of the same things like prescribing medications, prescribing lab or diagnostic imaging requests, conducting specialist referrals, etc. So it's really like being in a doctor's office, just in a virtual setting. And like I said before, all records are stored in a confidential platform, and privacy standards are upheld and really important to Maple. So you might be wondering what people can call into Maple for support with. On this slide here, you can see a listing of examples as to what people can call in for. These are just this is just a short list, but it's not limited to what's listed on this slide. So essentially, things that don't require a physical examination are what you can call into Maple for. Obviously, if there's a physical break in a bone or maybe a chronic condition that has been going on for quite some time, let's say 3 months or longer, that you've been experiencing something. An example could be chronic numbness and tingling in your arm or down your leg that you're not exactly sure what's going on there. If it's something that's chronic and long-term or something that you know really requires a physical examination, like looking in your ear, for example, to see if there's an infection. Those are the types of things that you would need to go to a walk-in clinic or go to an emergency room. If it's an emergency, don't call Maple. If someone's having a heart attack, go to the emergency room. But essentially, even if you do call in and you're unsure if Maple can help you or not, they will be the ones who can say, we might not be able to best help you. It might be best to have a physical examination at your local walk-in. They can do that, but at least they're a good starting point. But they can provide help with a wide array of concerns. Looking at the Maple physician group, just wanted to provide some information here. Like I said before, all of Maple's physician or all of their network are driven by physicians. So 2/3 of them are ER physicians and 1/3 are family physicians. So you know you're speaking with a top quality doctor. You can speak with the doctor via text chat, audio, or video. It really is up to the user. There's that option because it really depends on the situation that the person is in. Maybe they're in a public setting and they don't want to video or audio chat and would rather just talk to the doctor via chat about their symptoms and what they're experiencing. But obviously, some people like face-to-face consultations or audio. So it really is up to the user and how they would like to speak with their doctor. Like I said, they can renew prescription medications, they can prescribe new medications, like in any acute setting. They can prescribe lab testing and provide referrals to diagnostic imaging. Prescription medication requisitions are sent directly to the pharmacy. However, lab work or diagnostic testing is saved in the member profile, which you can download and print and bring to your local X-ray and ultrasound place or lab work center. So the only prescription medications that can't be prescribed in a virtual setting are controlled substances like narcotics, and that's just because they have to be followed closely. There are two options with prescription medication delivery as well. So the user can select on a map close to them a pharmacy that they can pick up their prescription, or they can have it delivered. Maple does provide free delivery of prescription medications as well. So it's really quick and easy to access care and receive a treatment plan from there. So now I'll throw it over to Shannon, and you can go through more of our BBD offering. Shannon,
I think after all of these years of virtual meetings, sorry about that. So we are very excited to bring Maple to your clients, either as an add-on to an existing policy or to a new group that you might be working with us on. The Maple offer that we are providing is not embedded within the health benefit, which you may see other carriers provide. This is sort of an a la carte option that your clients can add to their benefits program. And just as a bit of an FYI, in the market, Maple does have two different models. There's a 3-session model or an unlimited session model, and BBD has opted for the unlimited model for a cost of $4.47 per employee per month. This includes a flat 10% commission for advisors for first year and ongoing. Just to give you a bit of a sense on the competitiveness of that rate, if you were to go to other virtual, or if you were to go to People Corporation, historically, and get this price, get this product, sorry, the rate is about $8.33. So again, People Corporation and Health Solutions have been working together to help negotiate, because of the larger scale and volume that both People Corp and BBD can bring to Maple, this very competitive rate. Maple is PST exempt, so just the GST and HST would be applicable. So as far as eligibility goes, groups must have a minimum of 3 employees and $100 a month in insured premium to be able to add Maple. For standalone health spending or wellness accounts or groups who just want Maple a la carte, there have to be at least $100 in premium generated, which translates into about 23 employees that are being covered for Maple. Employees need to work at least 20 hours a week. Dependents meet our standard dependent definition for spouses and children, and coverage for Maple terminates at the employee's age 75. There are some extenuating circumstances where we may have groups on our books right now that have less minimum or smaller minimum hour requirements. And that may have been done through an exception process, and just wanted to confirm that employees who are in those classes that have been approved for coverage can have the Maple benefit extended to them. So we can start adding Maple to new groups and in-force groups with an October 1st effective date or later. We've been working hard behind the scenes over the summer to build our system to be able to help facilitate quoting this benefit as of September 1st. Just as an FYI, when we are ready to get Maple set up, either through a new sale or the amendment process, employees receive a customized email directly from Maple inviting them to register for their accounts. So in either situation, we will require employee email addresses. So those emails can be sent by Maple to the individuals. And Allison's going to touch on a little bit of that later. Next steps. So today is the advisor session, and tomorrow we're going to be reaching out by email to groups that aren't registered to receive our plan administrator bulletin. Our plan admin bulletin is scheduled to go out as well tomorrow. And so we're capturing both segments of clients just to make sure that they're aware of this great product solution that they can add to their benefits program.
Awesome. So now you're probably wondering what it looks like to experience Maple as a user. So we'll walk through that. Like Shannon just mentioned, all users will receive an email from Maple directly, inviting them to activate or set up their account. If a user previously had a Maple account with a previous employer or provider, they too will receive an email, a welcome email with a call to action. So in either situation, if someone has or has not used Maple, there is a call to action in order for users to activate their coverage with BBD, People Corporation. If they don't activate via the welcome email, they may encounter questions about why they're starting to see a fee associated with accessing services. So this welcome email is really, really important that everyone needs to activate in order to get coverage. So on the right-hand side of the screen, you'll see a screenshot of what it looks like for a user who has never had a Maple account. It will say, create your Maple account. The screenshot to the left of that is an example of an email for someone who has previously had a Maple account, and it's inviting them to update their account settings. So that is a very important piece of getting started. So once there is an account that is created or a user has updated their account, I should mention that if somebody previously had an account with Maple, they can continue signing in with their same username and password as before. It's just they're updating the coverage piece. So their username and password hasn't changed. They can log in as usual. So once we're into Maple, either on the web or on the app, this slide shows it in terms of what it would look like in an app setting. The first step is, logging in and indicating get care. You're looking for help. The second step is choosing the type of provider you'd like to see. General practitioner is the family doctor, ER doctor. It's that type of family physician that you would generally see for any type of primary or acute concern. There is the other option to select different specialists. So you'll see on the slide there's a dermatologist. You can select to see other specialists that are listed on the welcome screen. When you'd like to choose your provider, there are fees with seeing other specialists. It will indicate that, but seeing the general practitioner is what you would typically choose. You would then describe your symptoms. So there's a short questionnaire that the doctor will use to get an understanding of why you're calling in today. You will be put in a short waiting room. Like I said, it's typically 5 minutes or less until you're connected with a doctor. You can speak with them via text. Generally, to begin, they'll initiate conversation via text. and then ask whether you'd like to switch to phone or video, or just remain with text, and you can go from there. Once you've spoken with the doctor, the user will receive a personalized care plan. This will be confidentially saved in their profile. This is where you can see the treatment plan, the prescribed medications, if that's applicable, or any lab work or diagnostic imaging requisitions will be saved there as well, in order to be downloaded and printed when needing to be used. So that is a quick snapshot of what the experience is like. It's very simple and easy to use. There's a lot of great feedback on how Maple is very intuitive. And I do have some videos near the end of this presentation, which will be shared with you as well, which are really great to watch because it does give you that visual representation of what it's like to walk through each of these steps. The videos are very comprehensive, so I would invite you to watch those videos to really get a clear picture of what the user experience is like. With regards to eligible users, Maple is available to employees and eligible family members. Eligible family members are, your spouse or common law partner and children. Children 18 and above can have their own account. If younger, the child will be linked with their parent's account and must be present at the appointment. So if a parent is calling in about their child, the doctor will just want to see the child. The child obviously doesn't have to be the one who is verbalizing, but obviously if they can be part of the consultation, but they do just want to be able to see the child during the consultation. So that's something to keep in mind as well. If there's a child who reaches age 18 and would like to have their own account to protect their own privacy and confidentiality, they can have their own account transitioned from their parent over to themselves. Each user needs to have their own email address. So in that situation, the 18-year-old will need to have their own email address to set up an account and have their account transferred over. So the unique email address is really important. This often comes up with partners who share an email address. If you have a joint account with your spouse, only one user can use that joint email address. The other user will have to have a unique email address as well. So that is an important feature as well. With regards to communications, these will be included in the communication that will go out to you at the end of this week. But these are just some examples of some of the communication material that are available to clients who choose to set this up. There are posters, there are postcards. These are great to have around the office in common areas. So that there's that visual reminder of what is available. As we're heading into cold and flu season, this is definitely a good time to be putting those up in common places. There's also a plan sponsor and a plan member guide. So this is a very comprehensive guide that includes all of the details about Maple. It includes frequently asked questions and is a one-stop shop for where you can access all you need to know about Maple. So again, those will be included at the end of this week's email. In addition to these video resources, like I mentioned a few slides ago, these are really fantastic videos. They're 1 or 3 minutes. They're great to share with your clients who are interested in understanding what Maple looks like. So I would encourage you to share those and watch them yourselves. They're really, really great to understand and the full employee experience. With regards to Maple, we have received nothing but positive responses from our clients about Maple. This is just a slide that shows some testimonials about Maple. I was doing a comparison of different virtual care providers the other day, and Maple did top the list in terms of rating by users. So I would say that you're in good hands with Maple. And if there is any concern or feedback, we're always open to hearing that and ensuring that we're working with Maple to provide the best quality service as possible. Okay, so as we've run through that, we can turn to the Q&A and see if there's any questions.
Thank you, Allison. So there are a few. Wendy was wanting to know what specialists can the Maple physicians refer employees to?
Yeah, they can refer just like any family doctor. We don't have an exhaustive list at the moment. I mean, I can try to get my hands on one, but it is typically just seeing a family physician. You know, they can refer to an ENT, I'm trying to think of other specialists, but dermatologists, they can refer to any specialist, really. But if you would like to have an exhaustive list, I will make a note, and I'll try to get my hands on that.
That would be great.
And
Maybe we could include that in our
yeah.
follow-up email to the attendees today. I
Yeah.
did read just in some of the other information I've come across in putting this Maple product together that mental health therapists are one of those specialists that employees could be referred to. And I shouldn't limit it just to employees. Obviously, it could be their dependents as well. And so although the cost of seeing that mental health therapist may be paid out of pocket by the individual, that particular category could potentially be run through the benefits program, the extended health benefit, for reimbursement. So just to keep that in mind as well. So, all right. We have a question here. If we don't presently have the group, but the Maple benefit would be over $200 per month, could we do it as a standalone benefit? So yes, we could. I think that translates to about 23 employees at the cost of $447 to be able to get to that minimum $100 a month amount. But yes, we can offer Maple as the only benefit that we're administering for that group, as long as we can hit that 100 life mark. We have a very specific question, Allison, and Brian, if you do want to maybe elaborate more, if we're not understanding the question properly, I encourage you to just ping us and we can maybe turn your mic on. Brian is wanting to know, he said, the welcome email says it's from People Corporation. Is this personalized to reflect my company name or the group name?
This is the standard email. So to answer that question, it won't say the specific company name. It will say People Corporation. But I know we always encourage clients to let their employees know that they should be expecting communication from Maple. So it shouldn't be a surprise that they get an email from Maple. They won't know, they won't think it's junk or something that's not intended for them. So anyways, I hope that answers your question, Brian. It doesn't say the company specific name, but if you have any other questions about that, let us know and we'd be happy to help you.
Thank you, Allison. Brian did confirm that that was specifically where he was seeing the People Corporation. So thank you.
Perfect. What?
Okay. Shelley was asking a couple questions. So do all employees have to take part or only those interested in the service? Obviously, I think I can answer that one. When an employer makes the decision to add Maple, it can be done to all employees. It can be added to a class of employees. Now, here's a specific question that just came to mind. If you had a group of, 10 employees where we have their full line of benefits, and Maple is one of those benefits that's included, when we are billing, are we billing based on mandatory participation for who's eligible for the benefit, or just those who have selected that they want the benefit and gone through that registration process?
It would be for those eligible.
Thank you. Perfect. When lab work is ordered, I assume the physician will connect with the patient once they receive the results. Will the results be shared with their family physician?
Results are only shared with family physicians if the employee asks for that to be done. But yes, if there is lab work done and the individual doesn't connect with their family physician and ask that records be transferred over from Maple, then yes, a family doctor from Maple will follow up.
And we thank you so much for joining us today. Very excited to partner with you in distributing this product to your clients. So thank you very much. If you have questions, please feel free to reach out to your Director of Partner Solutions on the TPA side or your BBD client manager. They've all been trained up on this product as well and happy to assist where they can.